Secretary of State for Health and Social Care, you are announcing some new measures today, in particular changes to the NHS app that will hopefully cut waiting times. Can you just explain a bit about what those measures are and what patients can look forward to?
Yeah, these are just part of the plan the Prime Minister's setting out tomorrow to cut NHS waiting times from around 18 months, where they are today, to 18 weeks, which is where they haven't been for more than a decade, but where patients need them to be to get seen on time. So this is a package of investment, but also reform and modernisation. So making sure that via the NHS app that people can choose and book their appointments. They're given a wide range of choice of hospitals to be treated at, to make sure they can interact with the NHS with the ease and convenience we can, so many other aspects of our lives. It's also a way of reducing waste. We reckon we can get rid of many of the 1 million missed appointments that people don't turn up to because they don't get timely information in advance, still relying on letters that arrive after appointments, and also don't get the reminders that we often get if you book a appointment at a restaurant or a hairdresser. You'll get text messages in advance. Why aren't we doing these practical, simple things through the NHS? And there are so many other things as well, making sure that we incentivise GPs to keep people out of hospital and treat them in the community where that's appropriate, getting rid of some of the pointless outpatient appointments that people don't need. So there are a wide range of reforms we're putting in place, as well as the investment to deliver the shorter waiting times and higher patient satisfaction that we had under the last Labour government that's been squandered in the last 14 years.
Now, you mentioned about the offering patients more choice. I believe that they could be offered anything up to 5 hospitals to choose from. How feasible is that, given that many patients struggle to get treatment at just one hospital at the moment? And what happens if one of those hospitals is suddenly overly popular? How will you decide who ultimately gets to have their treatment there?
Well, this is both a principled and pragmatic approach. Principled because lots of people do exercise patient choice. The wealthy, the well-connected often know who to ask or where to go to find out where the shorter waiting times are, where the best consultant is. And of course, wealthier people, if the NHS can't see them on time, will opt to go private. With Labour, will fund people to go private so they don't have to, free at the point of use like they'd get on the NHS. So this is a way of giving patients real power, not making assumptions on behalf of patients about where they'd prefer to be treated. Some people, for example, might want to go to a hospital that might be further away from where they live, but closer to where relatives are who might look after them after they've had a hip replacement or a knee replacement. So this is about delivering faster access to treatment, shorter waiting times. It's also about making the NHS a more modern, reliable, easy, convenient service. Ease, convenience, these aren't words we would associate with the NHS today, in all honesty, but there's no reason why the NHS shouldn't be as easy, convenient to use as any of the other services that we use in our lives, particularly at the touch of a button on our smartphones.
Now, I'm keen to discuss the NHS a bit more, but it would be remiss not to mention, given the amount of coverage it's got in the past week, we have seen, obviously, that the grooming scandal, some might call it a national disgrace, never mind scandal, has obviously hit the news in the past few days, quite rightly so. What can you do as a government minister to reassure people that the government are taking what is coming to light seriously? What are you going to do to ultimately help those who have been affected by it? And really, can we actually trust the government to ultimately deal with it, given, obviously, the Prime Minister's former position and his sort of like the accusations he faces about the past?
Well, it is a national disgrace what happened with these grooming gangs and actually ongoing violence against women and girls in particular, paedophiles preying on our children. These are scandals and they need to be addressed. We had a national inquiry under the previous government led by Alexis Jay. Not a single one of those recommendations was implemented. We're going to implement those. There are other issues that were thrown up by investigations in places like Rotherham about the extent to which there was widespread corruption corruption in the dishing out of taxi licences, and also the extent to which people were afraid to speak up for fear of being accused of racist or upsetting community cohesion. We can't have that. What I'd say about Keir Starmer is that as Director of Public Prosecutions, he opened up a lot of historic cases to go after people who thought they'd gotten away with it. He put in place specialist prosecutors so that we put rapists, sex offenders, paedophiles behind bars. Jess Phillips, our victims minister, spent her life outside politics supporting victims of violence against women and girls to get their day in court and put rapists and paedophiles and sex offenders behind bars. hospitals in different country and start learning lessons now about what's going well and what's going wrong this winter, so I can start planning now for next winter so that year on year people see the NHS improving.
Wes Streeting, thank you very much.